Dr. Ghatan, I assume that a dermatologist who works with the skin mainly, maybe only, that you're going to see your share of tattoos from people who at one point thought it was a good idea and then not so much later. How's the technology about tattoo removals? Has it improved? Can it be done?
Yes, tattoo removal has advanced substantially over the years, and we have lasers that are very effective in removing tattoos. We caution the patients that this is a process that takes time, depending on what kind of tattoo it is, how old it is. The older it is, the easier it would be to remove it. It also depends on the color of the tattoo. Some colors are more difficult. For example, green is much more difficult to remove than it is black color. A professional tattoo would be more difficult to remove because the ink is placed deeper under the skin, whereas an amateur tattoo is easier to remove because the ink is not as deep. So these are kind of things that we have to explore with the patient, explain to them, and tell them that really needs patience. And it's what the tattoo is doing really, it's a light that it's exploding the ink under the skin, and the body is removing this ink little by little and getting out of the system. That's why it will take a few treatments and take some time for this to get out of the system and get rid of the tattoo. There is minor risks of scarring. That's if it's done properly and with the right laser, the risk is very minimal. There is some discomfort, we tell them, yes, there is, but it's bearable. We normally don't need to anesthetize to numb anybody. And if it's a very, very large tattoo, we try to do it maybe in a couple of sessions, break it down in different smaller areas at a time.
Right. So the average tattoo needs, let's just say a small whatever, a butterfly, something like that, needs on an average one visit, or does it need 2 or 3? If it's a professional one which was deep under the skin, does it need several visits to go over that whole area? Or is that what you said? I don't remember anymore. Didn't quite get it.
Yes. It on the average, it can take 5 treatments. There are times that it takes 10 or more treatments. Again, depending on the color. Mm-hmm. Some colors are very difficult to remove.
Mm-hmm. All right, I got it. Yeah, but it is doable. Let me ask you one question about a tattoo which has little to do with removal, but for people out there to know as they perhaps embark on a tattoo, is it true that, that ink, which, that's what a tattoo is all about, that actually that ink to a certain degree acts poisoning to the body while you have it in it, or is there no such evidence?
But there are drawbacks with tattoos. The issue of poisoning is something that would be in one's mind. I don't know if it's proven, but there are people who've had allergic reactions to tattoo, and they develop rashes at the side of the tattoo. There is a possibility of getting contagious infectious disease through the tattoo placement. We like to encourage people not to do it to begin with. We don't think it's a healthy thing. We don't think it's a good idea. Most of the time, people do it in their younger ages. And then later on, when they want to enter the workforce, they realize, especially if it's in an area that's visible, they're looked at differently, and they often feel remorseful, and that's when they come to us to remove the tattoo. So if you can educate our youth to avoid this to begin with, I think it would be preferable.
All right. Thank you very much. Thanks for your candidness, Dr. Ghatan.